All right, welcome everyone to New Current Conversations, our third with Haldane Superintendent Dr. Phil Benante. He has that rare honor of being our first third time guest. We're very excited to talk to him tonight about this new pandemic school year. And we're sure everyone has questions. We're going to try to get through as many as we can in the 30 minutes we have. You can submit them through the Ask a Question button that you can find towards the bottom of your screen, or just through the chat, which should be open on the right-hand side. You can submit that now or at any time during the conversation. And with that, I'm going to leave it to our editor, Chip Rowe, who's going to be running the Q&A.
Thank you, Teresa. I have mixed feelings about seeing you for 3 times because I think 18 months ago, we were talking about the same thing, and it's hard to imagine that we'd still be here. I guess we weren't anticipating the Delta variant.
Right.
We were anticipating the vaccine, I think, at that point. They were.
Right.
And I think one thing that I've been thinking about lately is this concept of learning loss. That I know superintendents, teachers are all talking about. And I was curious, how do you measure that when these kids are coming back after a year out of school? Is there criteria to measure that collectively? I'm sure each individual kid, the teacher is kind of seeing who's fallen behind, who hasn't. But is there something in educational policy where besides testing, that you can recognize the effects, if any, of the Zoom learning or kids being home?
Yeah. So first, Chip, thanks. What an honor to be a third time guest. Wow, I wasn't expecting to hear that.
Talking about something else.
But thanks for giving me the opportunity to come on, and thank you to Teresa, who I know has disappeared behind the scenes, but I really appreciate it. So we in other districts would have formal standardized measures, as you alluded to assess academic learning loss, and we feel good about what we have in place to measure that for our kids. But I think what we see presenting more so now than maybe we realize now that we have our bearings is the long-term social and emotional impact that COVID has had on some students and their families, and that is largely assessed just through our interactions with kids on a day-to-day basis. And that was really the importance behind making sure our kids got back into school and that we had direct contact with them. And in these cases, whether it be our professional staff, our clinicians, or our classroom teachers are doing a great job of making sure that they're referring students or their families to other community-based organizations who can play a supporting role, or the internal supports that we have in place at school to begin to work with students and or their families to address needs that are presenting in that area. So we knew this behind the scenes, that this was going to be an issue, but when you don't have students in front of you each day, it's hard to really assess that, or to what extent that's having an impact on the student or their family. So for our district, we were fortunate as compared to most others to be able to have the large majority of our students in school in some capacity last year. That being said, we know that many districts were unable to, but we have been able to. But even with that, we still see definitely the impacts on the social emotional level more so than the academic level.
Do you hear from teachers that it's, my kids are in high school, they seem to be rolling with it, but they're also young adults. And do you hear from teachers, and maybe the elementary school teachers notice, I don't even know what you'd see. I mean, a kid kind of withdraws, or what the effect of this isolation had. Is it younger kids more versus older kids, or is it sort of depends?
Sure, it manifests differently across the spectrum there, K-12. So it could be withdraw. It could be some more isolating type behaviors. It could just be, again, when you think of lack of socialization, just seeing as a group, not seeing students interacting in the ways that you normally would come this point in their lives. yeah, it really manifests in different ways. There's some other risk-taking behaviors, obviously, in more severe cases that we would see within a student or a young child that may draw our more immediate attention. But if we're not creating the space, and I think this is something that we've had to be really mindful of, if we're not creating the space inside of a classroom environment to give kids a chance to talk, give our students a chance to interact with one another, to reacclimate to being in a group environment, we may not see it. So our message to staff has been, we don't need to push the academic component of our program too soon. We want to take the time to check in with our students, in particular those at the secondary level, to see how they're doing and to make sure that we're taking the time to listen and to hear them and what their experiences have been, so that we can provide the appropriate supports if necessary. And other than that, kids just need the space to process what their lives have been like over these last 18 months, to connect with one another. And that's an often overlooked but really important part of school. In the standardization era, in the accountability era, it's become a lot. There's been a heavy emphasis on academics and academic performance, but the way our kids come into Haldane each day and how they interact with one another is really important in their social and emotional development. And we need to make sure that we're attending to that right now.
You had sent out said in a newsletter last week, I think, that 88% of the staff and teachers are vaccinated. And I was curious what your thoughts are. Today, this mandate began for the healthcare workers. And you do wonder, is the governor, who has said, basically like the mask policy, she basically said this is to save the school boards from having to deal what you're seeing in Florida, with people screaming at the school board and providing cover. I wonder if you think we're going to see that with the instructors, a mandate from the state, and then if you have any kind of plan. I mean, we're kind of seeing it play out with the hospitals, talking about bringing the National Guard in and that kind of thing. But what happens if you lose 12% of your staff and teachers? And you're not the only school district, obviously, having to deal with this, but I wonder if you've thought about that, or if there's a plan, or if you think that a teacher vaccine mandate is likely, or one of those things they won't do.
Yeah, I'd only be speculating, but if you look at what's going on elsewhere, I think we'd be remiss if we didn't say, well, it's probably coming at some point, whether it be this year or next. That's to be determined. But I do think that, in order to keep our schools running, to keep students in school, and to avoid what could be otherwise unnecessary quarantines, I do think that it's reasonable to think that at some point there's going to be a vaccine mandate. What I try to follow right now is whether it be the companies or the other institutions that do, in declaring that there's going to be a mandate, what is the impact then on nudging those who have not yet become vaccinated to get vaccinated? And it does seem to be, depending on where you're looking, it does seem to be effective. So my hope would be with that, that it wouldn't lead to myself and our school board being in the position of 12% of our staff no longer being eligible to work for Haldane. We care about our staff. We want to make sure that they have access to accurate information about the vaccines. The Department of Health has been absolutely outstanding to work with through the vaccination process. They ran several educator-specific vaccination events last year. That's why we were able to get so readily to about 80%. We're up to 88% now. So my hope would be within time, this is not an obstacle that we have to overcome. It's not a hurdle. I'm encouraged that close to 90% of our staff are already vaccinated, and that in time, for whatever reason, the other 10% to 12% will come along. I will say that, I've heard from some staff members who've just been candid with me that in some of these situations, they may have had COVID, so they feel that they have this, current immunity to it, which is valid to a degree. We have others who have sensitive medical conditions who based on the advice of their practitioners, have guided them against getting the vaccine. So my hope would be, again, over time, as the vaccine continues to be demonstrate to be effective, that the remaining 12% will come along. The last position I want to be in is to have a discussion with an employee about their future employment at Haldane if they don't get vaccinated. I mean, talk about a situation I never thought we would be in and had never envisioned 18 months ago. But I think, as you noted, it certainly is heading in that direction where there very well may be a requirement in the future. And I think we can understand why. This continues to impact our community. I think we're read the national statistics where it's over 2,000 deaths a day again. And while some of the signs were encouraging 6 to 8 months ago, we find that it's still having a significant impact on our communities, and thereby that a significant impact on our schools.
Well, we're very fortunate. I mean, if you look at the Phillipstown numbers, I think they're at 99% of people over the age of 74. Yeah. It is a little disappointing that Putnam, the adolescents 12 to 15 is still like 60%, but you do have 75% of adults have been vaccinated. Can you tell me, can you break it down as far as my concern would be the elementary school teachers more so because the kids can't get vaccinated yet, although you would expect by the fall of 2022, they're just going to add that to the vaccination list, once they've approved this and they've shown it's safe for 5 to 12. That I would not be surprised if the fall 2022, it's just one of the vaccines you have to get. But can you say like 90% of the elementary school teachers, have you broken it down that way?
Yeah. So not for public consumption, but obviously we know where potentially we would be more vulnerable or where students would have greater vulnerability, and that's at the elementary level. And the far majority of our elementary staff, and that's inclusive of teaching assistants and aides, are vaccinated. So again, we've done a good job. As you noted, our numbers, not just at Haldane, but locally, are high. And I point to that. The fact that the community has taken this seriously has enabled us, is a factor in enabling us to provide the experiences we've been able to provide thus far to our students. So if the community wasn't taking it seriously, that would be many more students coming into school or staff members coming into school, potentially while infected. It would be, exponentially more quarantines and disrupted learning. So that the community's done right by us, and we're trying to do right by our community.
Have you seen people taken their kids out of school? As far as there's the mask, I guess, would be the thing that maybe upset people since there's no vaccination mandate. But have people pulled out? Have you lost students to the mask mandate where they've just started homeschooling them?
Actually, it's interestingly, it's probably more the opposite. I've seen a few families, because again, out of a significant concern for their own well-being, maybe they have someone in the home with a serious medical condition, who just still do not feel comfortable having their child in school each day, so that they've elected to homeschool their children. I did not encounter a lot of resistance with the requirement for masks. It was there. I would say, a few parents had expressed concerns earlier in the summer. I would say by August, before Governor Hochul's announcement, we had already announced that masks were going to be required. And I think by that point, whatever the narrative was that was going on in early summer, and this is why I'm not really on social media, but clearly there was stuff out there because I was hearing from some families, some concerns, and I think that was consistent with what other districts were hearing as well. By August, whether it had been updated studies that had been released, whatever it may be, or flaws had been identified in previous studies that had linked masks with potentially being dangerous to kids, were debunked. I was not encountering the level of resistance that I was earlier in the summer, or anticipated resistance that I heard earlier in the summer.
I think some of that is, when you're talking about elementary school kids, we talked about this 18 months ago, a kindergartner keeping the mask on a first grader, very challenging for parents. And they're vulnerable. And so I can understand that, I guess, concern, which is another reason you sort of want all the adults to be vaccinated at least until the kids can get their shots too.
Absolutely.
Speaking of mask wearing, we have a student journalist who's done a great job at Ezra Beto, and wrote a column about his concerns about kind of I don't know what the word he used, but people get mask weary.
Mm-hmm.
They go around your neck, that kind of thing among students and teachers. But how do you enforce that? I mean, as an administrator, a teacher, you tell a kid to put the mask back on, you got to do that 20 times a day. At some point, I think we talked about this in the previous, nobody's going to get suspended, but there can be conflict in that,
right,
where they've got to maintain this, they've got to keep it over their nose, that kind of thing. Have the teachers had, been able to basically the kids comply, or has there been problems in that sense? I guess I'm thinking of the high school kids more.
Yeah, so I appreciate you bringing that up. And Ezra, I read Ezra's column. So Ezra is a great student, and he did a nice job. It was a very well-written piece, and I know that. I take that seriously. I know Julia Sniffen, our high school principal, also takes it very seriously. And I think when it comes to enforcement, that's the line we're trying to navigate. As you indicated, we don't want to discipline a student for not wearing their mask correctly. And but yet there does come a point where we just need them to do it, because it can become not only an issue for safety now on campus, but also it can become a larger issue within the classroom context. This is a matter that's, for whatever reason, has become politicized, and we just really need our students to comply. And our teachers are doing all that they can, as well as our administrative staff, to remind, cajole, whatever it may be. And our students, I would say, are largely compliant. When you see a group of students walking down the hallway and the mask is slipped just below their nose, hey, can you pull your mask up? They comply right away. We haven't had any student just outright defy our requests to wear the mask. More often than not, they're just not being worn appropriately, or as they're interacting with one another, they pull them down. As you know, we try to make good use of our campus space. We feel that's important. So we have students outside for lunch. We have students outside for classes. When they go outside, they take the mask off. When they come back in, sometimes they need to be reminded to put it back on. So it has become a bit of we may sound like a bit of a broken record, but I do think that we see the far majority of our students, if not all of them, complying with our requests to adjust, to situate appropriately. It just has become one of those things now, one of those routines we have to incorporate into our classroom procedures, into our building procedures. No different than 6 years ago, it was put your cell phone away. So, I think our staff's doing a really good job with it. And Ezra, made a good point. And of course, what we're encouraging other students to be mindful of is, if you see something like this, one, you can say something to your classmate. That's fine, as long as there's a respectful way to do it. But also to let us know.
I mean, even saying it to another adult,
well, true.
I think it's hard. Like, my kids are both vaccinated, so to wear a mask, you're like, it's redundant. I think that's maybe what people feel like. If you're vaccinated, I'm not the problem. It's the unvaccinated person. But it's hard to explain to them that you could still pass it on, even if it doesn't give you the symptoms or whatever. That's a really difficult concept to always be thinking of. Well, I'm trying to protect the people who aren't vaccinated. But again, in the high school, you can be vaccinated. So it just seems like a different situation than what you're looking at the elementary level.
I think there's a little of that at the high school. We know, just anecdotally, a number of our students are vaccinated. We haven't come up with a vaccination rate for our high school population yet, but I do think that is part of their mindset in that. And especially as you go in, you've been out in the community, Chip, when it's very uneven when you go out into town, or when you're out on the weekend, whatever it may be, wherever you go. And I think our students are social creatures themselves. They go out on the weekend, they are at each other's houses, they're out in town, whatever it may be, and they may be vaccinated, and they're taken upon them. They may not be wearing a mask all the time. Then they come into a school setting, and it's now an expectation. So I do think part of their mindset, though, is that they're vaccinated. So why should I have to wear a mask? But it still is important too, as you know.
Yeah. It's odd because I now, and I don't know why I do this, but I wear a mask when I go outside and I take it off when I come inside. So I've got it backwards in my head, but I feel like safer on the street with a mask on. But then so I'm just done with the masks. I don't want to be talking to you about this in the fall of 2022.
I think every superintendent's done talking about masks, but it's it's part of our world right now.
Yeah. Well, when you tell the kids too, you're part of history, that doesn't go over very well either. So let's talk. So you got the district got quite a bit of money, federal funding. But they're making you spend it on specific things.
Yes.
How specific do they? I mean, is it vague enough that districts, Haldane and other districts, can spend the money where you need to, or is it very restricted? You have to buy it for filters or whatever they say.
Well, I appreciated it was prescriptive, but I do think written into the accompanying regulation, it's broad enough to address what are the most pressing needs that districts are facing. So if it's an issue with ventilation or air quality, you can direct the money to that. We were in a relatively good place, we felt, with air quality or ventilation, those types of needs. So we directed it towards staff. So we had 2 interventionists on, 2 additional teachers on last school year to support remote learners. We decided for the time being to keep one of them with us to provide further intervention support in anticipation of academic learning loss, as you started with, and then other needs that may present throughout the course of the school year. So we're still holding a portion of those federal funds. We have 3 years to utilize them just to see what other needs may present. We may continue with just additional staffing. We're off to a good start with that, and we feel good about how we align that support. But if other needs present, because as you noted, this continues to evolve. So we're holding a portion of that federal money aside just in case, but we stand ready to utilize it if something else were to come up.
I think when you brought up learning loss again, it made me think the real challenge must be, the special education programs. Is a special education student at home really doesn't work. I mean, you have to have them on campus, you think. I mean, and that was I think we did discuss this last time, the challenge of the Zoom meetings and classes and all that. Have the special education students more or less all come back? Are they all on campus?
Yeah, so this goes just going back to this time last year, maybe a little prior, as we were planning for the start of the 2020-2021 school year. We entered into our planning with an equity mindset or an equity focus. We knew that we were at a point where there would be students who are at greater risk if we did not have them come back to school immediately. So we prioritized from the start our early learners, so our kindergarten, first, second grade students. We wanted to make sure that they were in 5 days a week, right from September. And then all of our special education students, all of our English language learners, we contacted those families regardless of grade level. So even our high school students, where we were on a split schedule, we made accommodations with those families to have those students in school every day from the start of September of last year. So we feel that was a great decision. And I wouldn't say that about every decision that we've made over the last 18 months, but that was one where our team was really, it was prescient in that, anticipating what potentially could occur if we did not have those students accessing school in person every day from the start, and we went ahead and put those plans into place. So I think we actually are in with our special education students and other students. We're actually in a really good place compared to where we could be had we not made that a priority back last summer when we were getting ready for last school year.
Yeah, I think I asked you this last time because it's a tough question, but you do look back at the 18 months, and is there something you would have done differently. But it was like everything was kind of being decided week by week. We didn't have a long view, right? I mean, you didn't know 6 months we should do this, we should zig this way because in 6 months it's going to be like that. It was every decision was kind of, I mean, in covering it, that's, you know, we just kept, seems like there was a new story every week that went a different direction.
Well, right. I mean, I think we can all relate, right? We thought the initial shutdown was going to be 2 weeks and we'd be right back to business as usual. And it was anything but that. And, you know, we're part of a larger system. So we're somewhat dependent upon the message that are coming from the governor's office, or we're coming out of the governor's office and the state education department. And I don't, in looking back, just, you know, the question in there, was there anything we would have done differently? And nothing major stands out. Of course, there's these situations that we found ourselves in that were more pressing in terms of time that I look back on, and I thought, you know, you know, probably should have seen this. You know, you're self-critical, but I think our administrative team did a really good job working with our teachers and our teacher leadership of anticipating what issue and staying in continued communication with them. So we had this real clear line between, you know, what was coming into the district office, so from state ed or from the Department of Health, and making sure that our classroom teachers were well informed about what was going on, and that's a credit to our building principals and to our district office staff. I think if any teacher were listening, well, I may say I didn't really know, I didn't know everything that was going on, but I think there's a high level of trust in our organization that everybody was doing the best that they could given the circumstance. And I think if there's one regret, it's just not honoring that and appreciating that all along. You know, you kind of had this feeling that you're in this battle, and I still feel that a little bit, but didn't have the space to step back and probably honor, you know, the remarkable work that was going on with our families at a classroom level, as well as I would have liked to. I hope my staff's understanding of that. You know, we were all just in this situation where we're trying to keep up and keep the organization running. But I do think that we did an excellent job, all things considered, through the spring of 2020 and then through last school year. I'll say that, you know, I think it's remarkable looking at the start of this school year as compared to the start of last school year, just the level of anxiety and the uncertainty that we were all bringing into last school year. I really did not know how long we were even going to be open for, you know, and we were open for the full year. I mean, we had a couple periods of time, as you may recall, where we decided to preemptively close, or we did an extended all remote option after a holiday break, just out of an abundance of caution because we knew people were gathering. But the good news going into this school year is that there wasn't that kind of anxiety coming in on the part of our staff. I think we're largely now have adjusted our lives, no different than everybody else has, to these new health and safety routines, and understanding, you know, what the risks are and what they aren't, and keeping this in a good place inside to the extent that we can. Someone told me recently that really COVID years should be thought of like dog years, you know. So now we're, you know, 18 months isn't really 18 months. And I couldn't agree more. I mean, it's felt like 5 years, and I know it has for our teachers and our families. Yeah.
Well, I also think, I just think as we, the current, you know, cover Beacon and Haldane and Garrison, we didn't, I don't want to say we didn't have it as bad, but we're small. The schools are smaller. The community got vaccinated right away. I mean, high rate of vaccination. And you're reading about these districts north of us, you know, who are requiring football players, volleyball players, you know, they have to get vaccinated to compete, which we don't have. You're not seeing, you are seeing some football games have been canceled. Both Beacon and Haldane have lost games because of, you know, quarantine. So you just kind of you want it just to go faster. You know, you want it to roll faster so we can get ahead of it. And we're almost there here, like 75%. So that's the one thing that's interesting, to look at other districts in other states even. And especially the Florida situation where the school boards were kind of left on their own. And so each one could make their own decision. The governor's telling them they can't have mandates. They make a decision too, and you have these raucous meetings. which I think, New York sort of cut that off with the governor saying, it's hard to argue with that, to go into argue with a superintendent about it. It's like out of your hands at that point. So that, I think, was different about New York State.
It is, but I think that I would hope that our community, to a degree, is looking at what's happening in other school systems, because I just can't help but to think the impact that has on a child when the focus of conversation at Board of Education meetings becomes masks. It's not about teaching and learning. It's not about whether or not our kids are meeting our goals for them, whether it be academically, socially, and emotionally. When the narrative is about something like a mask, that has an impact on kids, and I think it has a negative impact on kids. So it's not us, and I think we don't want it to become us. And it's important to look to what's going on in other communities in the nation, and hopefully, step back and reflect on what we're doing that's contributing to a more positive environment in our schools. I think that's something we really want to hold on to.
All right. Well, that was all the questions I have for this episode. Hopefully we won't be talking about this again. We'll find another topic.
Yes, let's make the fourth time about something entirely different.
Well, I think it'll be interesting. The fall of 2022 is really what I'm kind of anticipating next. This school year hopefully will go as last year did, where we can stay in school, but you do wonder what changes will happen especially with the 5 to 12-year-olds being able to be vaccinated. I think that's going to change the environment quite a bit. That'll be the next kind of step in this process. So.
Agreed.
All right. Well, let's see if that's true. And for your fourth time with a conversation, we don't say the word mask.
Talk about Haldane athletics,
there's plenty of good things going on to talk about.
Exactly. All right. Well, thank you everyone for participating. We're going to be posting this tomorrow for those who couldn't attend on our website. Thank you, everyone. Good night. And
thank you, Chip.
Thank you.
You're welcome.